Hello,
Hello.
I am Dr. Vishwas. I am a doctor of this clinic. May I confirm your name and this, please?
Yes, doctor. I am Miss Sarah, 44 year old.
Nice to meet you, Mr. Sarah.
Nice to meet you.
Thank you. I came to know from your GP that you are gaining weight recently. Is it right?
Correct.
So I am going to discuss this condition with you. And I may take some note during our conversation, but all the information during our conversation will be remain confidential. So is that okay for you?
Thank you.
Okay. So can you please tell me in more details what is happening with you?
Doctor, I have diabetes for since 4 years. I am very keen about my blood sugar and about my diet. I keep it. I follow all the doctor instruction, and I am following with diabetic nurse with regular follow up. And my glucose level, 3 months glucose level is very controlled for long time with regular follow-up. But my nurse noticed recently increasing in my blood sugar. So she referred me to the GB for to start another type of treatment. But the GB when see me, he noticed also increasing in the weight, so he was referred to you for your opinion.
Yeah, I'm sorry to hear that. Can you tell me that how would you feel that your weight sense have you measured it before?
Doctor, my weight was stable for a long time, but recently I have increased in the weight for like 6 months.
Can you tell me that how much weight did you gain during this time if you have measured?
I'm following with my nurse. She noticed 11 kg during this 6 months.
And that you said that it was unintentional because you tried to follow the diabetic doctor.
Yes, I'm very keen about my diet, but in spite of that, I have increased.
Can you tell me that where did you gain the weight? Do you think that you have gained weight all over the body or parts of your body like in your tummy?
It is more in my waist and my tummy.
And you haven't noticed much changes in the limb, your hands, your legs.
It's mainly I have increased all my body, but more in my waist.
And was it increasing gradually or did it increase over a short time?
It is gradually during 6 months.
And can you tell me that along with this gaining of weight, did you notice any other symptoms like any changes in the skin,
Uh,
any
I
rash?
have
Yes, please.
Yeah, I have like fissure in my skin in my tummy.
Okay. And for how long you have noticed it?
This in same duration.
Can you describe that uh, t-shirts or skirts?
It is too many. It is in my abdomen, lower part of the abdomen. It has a color like red and purple.
Any other like this type of noticed in the hands?
In the hands, no.
And can you tell me that have you noticed that any changes in your hair, any hair fall or any coarsening of the hair?
In my hair, no. But I have more hair in my face.
Okay. And have you noticed that any changes in your vision, any bumping into object like that,
No,
any headache?
no.
And have you noticed any changes in your sleep pattern?
Doctor, nowadays I sleep very little and I feel tired all the day because of lack of sleep, maybe.
And do you feel that you are sleepy all the time?
No, no, but I feel tired all the day.
And you do not get a fresh sleep at night?
I have my sleep not as before. I don't know why.
Is it due to any pressure at your work, or any pressure in your mind, or anything like that, or you are having this without any other cause?
I don't have stress and I'm working at home, but even when I'm working in the house with the daily work at house, I feel more tired.
And have you noticed how many hours you can sleep at night?
Maybe 6 to 7 hours.
And do you think that you feel sleepy while watching TV, while taking food, or
No,
while talking?
no,
Okay, that's fine. Have you noticed any changes in your vision, any
no,
haziness,
no.
any other rash anywhere in your body?
There is no rush aside from the one I told you.
Have you
But
noticed?
maybe because of increasing weight, I have acne in my face.
Okay. And for how long you have noticed this?
Maybe last 3 months.
Okay. And if you don't mind, may I know that have you noticed any abnormal hairs on the male
I
pattern, like beard region, mustache region?
I have it in my face, as I told you.
And for this 3 months, or did it was
Yeah,
yes, please.
like 3 4 months.
Okay. Have you noticed any problem in your swallowing or taking food?
No,
Any nausea or feeling of throwing up?
no,
Any vomiting?
no,
Any hot or cold preferences?
no,
Any lumps or bumps anywhere in your body?
no,
Any shortness of breath?
no,
Any chest pain?
no,
Any racing or pacing of your heart?
no,
Any tummy pain?
no.
How about your bowel work?
It is fine.
Have you noticed any black stool or any blood in the stool?
No,
How about your water work?
it's fine.
Okay. And have you noticed any frothiness in the water work?
No,
Do you have any weakness at any side of your body?
it's not. No. I feel tired, but no specific weakness.
And do you have any pain in your joints?
No,
And you said that you feel tired. Is it all the day or any particular time of the day?
all day.
Have you noticed anything makes it better, like resting or taking food or anything else?
I feel tired all the time, but it's more when I do the house housework.
Okay. And any changes during the daytime, like more weakness in the morning or more weakness in the evening?
I think it's almost same.
Okay. And may I know that how this condition is affecting your daily life, your symptoms
Doctor,
like weight gain and weakness?
it's affecting so much, doctor. I cannot do the daily work, and my appearance become. I'm increasing in the weight with the acne and the hair and my face, and soon I will have marriage wedding for my son, and I'm afraid I will have problem with this appearance.
I'm sorry for that. And for your house assistance, I can contact the social care department, and they can do something for you, I think. Will it be okay for you?
Thank you.
And then I am coming with your concern, your appearance. I will try to solve that issue after taking the history and after examining you. Okay.
Okay.
And you said that you have diabetes. And can you tell me that for how long?
This is for 4 years.
And are you taking medication regularly?
I'm taking my tablet regularly and I'm following all the instructions.
Can you tell me the name of the medication?
Just two tablets. One is glipizide and the other one metformin.
You noticed any problem with the medication, like any diarrhea, any loose motion,
That is just fine. I'm tolerated for 4 years with no problem.
and any changes in the dose recently?
No.
Okay. And do you visit your eye doctor, kidney doctor, heart doctor regularly?
I visit, I'm very keen about my treatment and I'm following all the instructions. But last year I visited my kidney doctor and he noticed increase in my blood pressure, so he added lisinopril to my medication.
And you have diabetes and high blood pressure. Except this, do you have any other condition you are aware of?
I don't remember now.
Did you have any jaundice in the past?
No,
Any hospital admission?
no.
And you are taking the medications that you named, the three medication, two for diabetes and one for high blood pressure. Do you take any other
Mhm.
medication?
So far, no, but the doctor referred me for insulin. He said there is a plan to start insulin.
Okay. And any over-the-counter medication,
No,
any herbal products?
no,
Do you have any allergy to any medication?
no.
Any of your family members have this type of condition or any other condition that runs in your family?
My mother has diabetes. Otherwise, no,
Any other gland problem in your family?
no.
Okay, I need to ask you some personal questions. So is it okay?
Okay,
Do you smoke cigarette?
no.
That's fine. And do you drink alcohol?
Very little in the weekend only.
And did you ever take any binge drinking?
Sorry,
Any binge drinking?
what do you mean by it?
Any large amount of drinking?
No.
Okay, that is fine. And may I know that what do you do for living?
I'm house wife.
And I think that this condition is also affecting you, so that I can contact the social care department and they will try definitely help you. Okay.
Okay,
And do you drive?
I drive. Yes.
Okay, I will take a note on your driving before starting the insulin. And okay, and may I know that whom do you live with?
I'm living with my husband and two sons.
Okay. And are they supporting enough?
Yes.
So is it can I know about your diet habit?
I'm following the diet advice from my nutrition, and it's fine.
That's fine. And is it okay if I examine you now?
Okay.
So I would like to straight your arm.
Okay.
I am going to see if there is any signs of rheumatological condition, any signs of any deformity in the fingers,
Nothing.
any clubbing,
No.
any transectasia.
No.
I would like to see the pulse and any pulmonary edema, any wasting of the small muscles of the hand.
No.
Okay, and after that, I would like to know the blood pressure.
It's 150, 90.
Yeah, any other rash in the hands, any bruise mark.
There is a bruise in the elbow.
And may I know that for how long you are having this bruise?
Doctor, one day while I'm doing the housework, I nick my elbow in the furniture, and it suddenly it become there was hematoma and bruises,
I'm sorry for that.
and it's not usual.
I'm sorry for that. And I'm going to see the eyes for any anemia.
No,
And I would like to see the field of vision.
it's intact.
And
There's no.
after that, I see that you have acne and hirsutism.
Yes,
And is it moon faces?
yes,
And I'd like to see the mouth if there is any rash, any wall rash.
no.
I'd like to see the interscapular fat pad.
There is.
I am going to press on your backbone. If you feel any pain, let me know. Okay.
Oh,
Is there any pain?
no pain.
Okay. I'd like to see the neck gland for any thyromegaly.
No,
Then I would like to auscultate the lung if there is any diminished breath sound.
clear,
Any diminished breath sound?
clear.
Okay. And then I would like to examine your tummy. Is that okay?
Okay.
I'd like to see any organomegaly, especially for any suprarenal mass.
It is soft flaps with the stria and the abdomen with obesity, central obesity.
Okay. And any any ascites?
No,
Okay. And at this point, I would like to see the legs for any scar mark.
no.
Okay. And can you stand up without using your arm?
It is a little difficult.
Okay. Can you walk for me?
Okay.
After that, I'm coming to, and I'd like to see the hands for any finger prick mark.
There is insulin breakmark.
Okay.
This one, the checker.
Thank you for letting me examine you. And may I know that what is your concern?
Doctor, do you reach what's going on with me?
Actually, as I have examined you and taken your history, a possibility came in my mind that a gland in your body is acting more than normal. That is, it is overacting. So that they are producing some type of products that is causing this type of problem, like changes in your blood sugar level, changes in the blood pressure level, and you have acne, and you have excess hair on your face, and also you have gained weight from that. Do you get me?
Is it a cancer?
I suspect that it is a overacting gland, and it is unlikely to be cancer, but we cannot possibly rule this out. We need to run some blood test, some imaging test, and after that we can be sure that what is happening with you.
Is it curable?
If it is a problem with gland that we call Cushing syndrome. Have you ever heard of it?
No, no.
In this, the gland is producing excess part, and we if we give any medication after getting that where it is happening, and also there might be needed necessary to do any surgery to remove the gland, and after that it is almost curable, and with after proper follow-up it is a completely curable, completely controllable condition. Time off.
And uh, can I attend my son wedding after 2 months?
Okay, actually I can I need to examine you thoroughly. I need to run some blood test, and after that I can give you the opinion that if you are ready to travel this with this condition. And I cannot give you the guarantee at this time.
Okay, Dr. Biswas, what is your differential for this case?
For this lady, my differentials is this is most likely a case of Cushing's syndrome, and my other differentials are this can be a case of polycystic ovarian syndrome. I should have asked about her menstrual history, but I forgot to mention that. And also, I will consider it as a case of metabolic syndrome.
Okay,
And
what,
other possibility, though unlikely, that is acromegaly.
what other differential?
At this stage, my differentials are this.
And how are you going to investigate the patient?
Okay, for this gentleman, for this lady, I will go for the complete blood count to see anemia and white blood cell count level, then inflammatory markers, then liver function test, and then renal function test. That is serum creatinine and electrolytes, where I would expect this can there can be present with hyponatremia or hyperkalemia, and serum calcium level. And after that, I will also go for a special test like 24-hour urinary cortisol level. And then I will go for random blood sugar level, HbA1c level. And also, I will go for a special test like dexamethasone suppression test. That is low dose dexamethasone suppression test and high dose dexamethasone suppression test. After that, I will go for the imaging test like ultrasonogram of the abdomen, then CT scan of the abdomen, and also if these are came normal, then I may need to go for the MRI of the brain with special attention to the pituitary gland.
And what else?
I can go for the adrenal venous sampling.
And before that, to classify, is it age
Yes,
dependent?
before that, I will go for to classify if it is a case of adrenal this is Cushing disease or Cushing syndrome.
Yeah, so you will do ACTH.
Yes, I will go for the CTS level.
Okay, fine. And for the complication of diabetes,
Uh, for the complications, that is for diabetes, if it is by measuring the HbA1c level, and then for hypertensive complications, measuring going for the serum creatinine level, urine routine examination to see any urinary proteinuria, then urinary albumin creatinine ratio, and also serum calcium level, it is low or not.
okay. Thank you, Dr. So, before that, how are you going to manage the patient?
Uh, as this is a case of Cushing's disease, I need to involve the multidisciplinary team. First, I'll go for the non-pharmacological management, like educating and counseling the patient. Then, for her problem at home with this lifestyle, I will involve the social care department, and then I will go for her house setting, as she is having a problem in walking also, and the management as a house setting will also be needed. And after that, I will go for her pharmacological management with proper consultation with the endocrinologist, then surgical team, then physiotherapist, and my consultant, and the endocrine specialist nurse.
What is the complication of Cushing syndrome?
Cushing's disease can be complicated with uh, uh, diabetes mellitus, hypertension, then proximal myopathy. Then this can complicate with cataract in the eyes, Then this can present with hypocalcemia, then bone fracture. I cannot remember much.
Did you comment on osteoporosis
Yes.
in the history, risk of osteoporosis?
Sorry, osteoporosis and
Did you comment in the history for the osteoporosis risk?
no, I didn't ask especially for any osteoporosis. I asked only for joint pain. I should have asked about any specific pain in the hip region, any bone pain.
Okay, thank you, doctor. Can I comment on the?
Okay, okay, of course.
So you did well, doctor. So thank you very much for your performance. You try to rule out the pseudo Cushing in the history, which is fine. But I think you should mention it in the differential also, right? Or no need?
Which one?
Pseudo Cushing because of extra use of the alcohol like this. And
I thought that this is if the patient was high using high alcohol, then I would consider that
mm,
patients use a very moderate amount of alcohol.
mm, mm. And in the history, you don't comment about easily bruising, but you comment in the examination, which is fine. But you miss it in the history.
Yes.
You don't mention about osteoporosis.
Also
Uh,
depression. I haven't asked about depression.
yes, depression also. And you don't ask about the period and menstruation.
Yes, I totally forgot that.
And you miss a very important part in the history, which is the use of steroid at any route. It is one of the differential.
Yes.
Otherwise, you did fine. She did in the history. She didn't use extra steroid, topical or systematic, but she has easy bruising and she has change in menstruation. And when you ask about stria, you should ask also about any previous history of stria. That's all I think. But all over, very good performance. Thank you for. In the investigation, you miss the STH level, which is very important. It differentiate the
Yes.
Cushing syndrome from Cushing disease, dependent to STH or not. In the history, you rule out the cancer, which is the important part. Even in the examination, also you check. Okay, overall, very nice performance. Thank you.
Okay, thank you.